Huff, and I am recording this lecture on the concept of metabolism. All right, metabolism is the process of biochemical reactions in the body cells that produce energy, repairs the cells, and maintains life. Hormones are chemical messengers that are secreted by various glands that regulate growth, reproduction, gender differentiation, as well as fluid and electrolyte balance. Normal metabolism. Some of your major endocrine organs include pituitary gland, thyroid gland, parathyroid glands, adrenal glands, pancreas, and gonads. Growth hormone, thyroid hormone, adrenal and gonadal androgens, as well as estrogen, are responsible for skeletal growth and maturation. Some of your genetic and lifestyle considerations. The endocrine system is responsible for sexual differentiation during fetal development and for stimulating growth and development during childhood and adolescence. The growth hormone is excreted by the anterior pituitary gland. Growth hormone stimulates growth of muscles and improves bone mineralization. Concepts related to metabolism include acid-base balance, perfusion, oxygenation, and stress and coping. Alterations to metabolism, disorders and structure and function of the endocrine glands alter normal hormone levels and the body's way the body's tissues use these hormones. Hormone production increases or decreases when individuals experience alterations in their health, such as with diabetes, obesity, osteoporosis, and glandular disorders. Some of your common alterations of metabolism include diabetes mellitus, and this is related to the body's production and use of the hormone insulin. In type 1 diabetes, the patient is acutely ill at the onset of the disease. They usually require hospitalization for treatment of hyperglycemia, diabetic ketoacidosis or DKA, dehydration, and electrolyte disturbances. In type 1 diabetes, there is an absolute deficiency of insulin related to the beta cell destruction in the body. Symptoms of type 1, usually they present with nausea and vomiting, lethargy, abdominal pain, thirst, fever, blurred vision, and possible alterations in their level of consciousness. Therapy includes correction of acidosis and dehydration with fluids. Insulin is infused to correct the hyperglycemia. Type 2 diabetes has a more insidious onset, so it's a lot slower. It may develop over several years. In type 2 diabetes, they have a relative deficiency of insulin. It may be related to an insulin resistance or an inadequate secretion of insulin to meet the body's needs. Most common presentation is mildly elevated glucose levels with weight gain and increased susceptibility to infections. They may have symptoms of hyperglycemia as well, looking at thirst, frequent urination, blurred vision, and fatigue may also be seen. All right, so common alterations in metabolism. Another one is obesity, and that is a state which excessive calories are stored as fat. Obesity epidemics increase the risk of other diseases and comorbidities like hypertension, coronary artery disease, type 2 diabetes, stroke, fatty liver, gallbladder disease. Graves' disease is a thyroid condition that results in hyperthyroidism. Autoimmune disorder presents with symptoms of an overactive thyroid. They will have increased appetite, weight loss, hypermotile motile bowel sounds, diarrhea, heat intolerance, insomnia, and increased sweating. Hypothyroidism is another common alteration in metabolism. Hypothyroidism is an underactive thyroid. They have an insufficient production of thyroid hormone. It is the leading cause is an autoimmune disorder in the United States. In other countries, the leading cause of hypothyroidism is iodine deficiency, which we don't have to worry about because we have iodinized salt. So we get plenty of iodine through our salt intake. Symptoms of hypothyroidism include weight gain in the presence of decreased appetite, systemic edema, lethargy, fatigue, constipation, bradycardia, and altered lipid metabolism. So you can see everything is quite the opposite. And I don't remember if I told you on hyperthyroidism, they will usually have an increased heart rate. So they'll be tachycardic. All right, osteoporosis is when the rate of bone resorption increases and the rate of bone formation decreases. This results in a decrease in their bone mass. Cirrhosis is widespread destruction of liver cells, which are replaced by less efficient fibrous cells. All right, just looking at some statistics for prevalence in diabetes. As of 2011, there were 25.8 million individuals in the United States that had been diagnosed with diabetes. There is an estimated 7 million that have disease that are not yet diagnosed. Obesity, more than 33% of adults and 17% of youth are obese in the United States. And a lot of that is with fast foods, and we have increased the sizes of all the foods in fast foods. Like even the size of hamburgers are bigger than they used to be. We've gotten where we supersize everything. So we're eating a lot more food than we should. Men and women are equal in rates of obesity. Thyroid disorders, the prevalence of hypothyroidism in women in the United States is about 7.5%. In men, the prevalence is about 2.8%, so you can see it's higher in women. So about 38% of the world's population is affected by hypothyroidism. In osteoporosis, it is estimated that 12 million Americans and 44 million have low bone mass. White and Asian women are at the highest risk for osteoporotic fractures, and usually it's more common in your tall, thin women as well. Cirrhosis is a major cause of death in the United States. Two most common causes of cirrhosis are hepatitis B or C or alcohol abuse. Looking at genetic considerations and non-modifiable risk factors, type 1 diabetes, the individual must inherit the risk factors from both parents. So they have that gene for type 1 diabetes. Environmental triggers such as cold weather. Diabetes tends to develop more often in winter months than summer months. Antibodies in the blood also can trigger type 1 diabetes. Type 2 diabetes, a lot of times this runs in families due to poor nutrition habits that are learned in the home environment. Obesity, genetics do play a role in the disorders such as Bardet-Biedl syndrome and Prader-Willi syndrome. Also, having an abundant food supply and little physical activity leads to obesity. Osteoporosis is believed that predisposition is inherited. Bone health depends on genes that are inherited from the parents. Cirrhosis is not usually inherited. Some diseases that result in cirrhosis can be genetic in nature, such as cystic fibrosis, hemochromatosis, Wilson's disease, just to name a few. Prevention need to help the client identify and modify risk factors for the diseases. Healthy lifestyle behaviors are needed to prevent or slow down the onset of the disorders and prevent complications from the disorders. Screenings can be done for diabetes and obesity. In liver disease, alcohol abuse is the leading cause of cirrhosis. There's what's known as a CAGE questionnaire, and so these are the questions that you ask. So for the C, it's have you ever felt you should cut down on your drinking, and C is the cut down. A, have people annoyed you by criticizing your drinking, and so the A is the annoyed. G, have you ever felt bad or guilty about your drinking? G is for guilty. And then E is have you ever had a drink first thing in the morning to steady your nerves or change your energy level? And so E is the energy level. Some of diseases that result in cirrhosis can be genetic in nature, which we talked about a while ago with the cystic fibrosis, Wilson's disease, and your hemochromatosis. All right, looking at the assessment, the endocrine gland functions as should be assessed with findings from diagnostic tests, the health assessment interview that collects subjective data, and then the physical assessment that collects the objective data. So during the nursing assessment, health assessment interview, you should consider genetic influences on the health of adults, so family history of disorders, the age of onset, the gender of the family member that has the disorder. You also may be part of the health screening or total health assessment is important. Health history is going to include their medical history, family history, and social and personal history. So that would also include things like exercise. Do they drink alcohol? How much alcohol do they drink? You want to ask about changes in their normal growth and development, as well as changes in height and weight. When you're looking at injuries, have they ever had a head injury? Have they had chemo or radiation, especially to the neck area? Use of medications, especially hormones and steroids. All right, when you are assessing organs, the thyroid gland is the only palpable organ, and it is only palpable if the thyroid gland is enlarged. Otherwise, it should not be palpable. Other assessment provides information about endocrine problems, and this will include your skin assessment, hair and hair assessment, as well as facial assessment, looking at the appearance of the face. Other things that they will do is a thyroid gland assessment, motor function assessment, and sensory function assessment. And the last two are looking at the musculoskeletal system. All right, so along with the musculoskeletal assessment, they are going to include their height and weight with their vital signs. You want to assess for hypocalcemic tetany with Trousseau sign and Chavaskit sign, which we'll talk a little bit more in detail later. All right, diagnostic tests that can be done. Hemoglobin A1C, which looks at the average blood glucose level over the past 3 months. Then you've got your T3, T4, TSH. Those are your thyroid hormones when you're looking at the thyroid gland to see if it's hypo or hyperactive. There's also individual hormone levels such as your parathyroid hormones, catecholamines, estrogen, progesterone, growth hormone, just to name a few. Looking at serum electrolytes, liver enzymes, that's your AST, ALT, SGOT, and LDH. Bilirubin, serum albumin, serum calcium levels. Interventions in therapy, endocrine disorders are going to require a multidisciplinary care for multiple problems. Nursing care is directed at meeting the physiological needs of your client, providing education and ensuring psychological support for not only the client but the family as well. A holistic approach is essential, so they're going to involve the entire body. All right, independent interventions. The nurse can educate the client regarding the diagnostic testing that they may have to go through, the disease state of whatever's going on with your client, as well as therapies that are going to be used to help control the disorder. You want to help the patient develop a lifestyle that will limit complications from the disorder. You also want to ensure that there is a safe environment for your client, offer community resources for client support. All right, collaborative, extensive diagnostic testing can be confusing for clients. The client that is obese may need more testing to rule out any other comorbidities that may be going on. You're going to be collaborating with exercise physiology, certified dietitian. So that work looks at their activity level, looks at their diet. Behavioral therapist can be helpful for patients that can't make changes on their own. So an example is an alcoholic that can't stop drinking by themselves. These behavioral therapists can help them with that. Also, people that overeat. Podiatrist, they deal with foot care. Your pharmacologic therapy, the goals are going to vary widely with the different types of medications out there. Hormone administration is done as replacement therapy. Examples are going to be insulin, anti-thyroid agents, thyroid agents, hormonal agents, and biophosphonates. The biophosphonates are used to help slow bone resorption and preserve bone mass. So you'll see that used in osteoporosis. All right, and that's the end of the concept of metabolism. And as always, if you have questions, please get with me so we can help clarify things.